Ladies and gentlemen, please welcome Dr. Jan Einersen.
Well, welcome everyone. It's a real pleasure to start this meeting out with a very important topic. We're going to save the formalities for later and just get right to it because we are very short on time. We have three outstanding surgeons here who each have about 20 minutes to show some of the most important things in the retroperitoneal anatomy. So without further ado, I want to introduce this chair of the session, Dr. Ceccaroni, and he's going to basically moderate the session as well as do some of the surgery. So please, Dr. Ceccaroni, welcome.
Good evening, ladies and gentlemen, friends and colleagues. I'm very proud to be here today in order to chair this interactive cadaveric demonstration with very good friends and colleagues. I think that first of all, I truly want to thank the AAGL organizing committee, Dr. Enerson, Dr. Advincula, and all the scientific committee who invite us to be here as a peculiar part of this event. We are very proud to dress the T-shirt of this important society today. Only few words in order to introduce the philosophy of this small anatomical demonstration, which is we would like to contaminate you with our sickness, which is anatomy as a passion, but even as a philosophy. You know, I remind you that in the history, the ancient anatomical lessons in the university were made with a professor dissecting the cadavers with a huge auditorium, and they were opening the cadavers. If you think to this, you think that very little things changed during the centuries. We are now here to do something similar with the advantage of technology for sure. But this helps us to know that surgical anatomy is nothing, is not a dead branch of science. It's a truly living branch, and it changes year by year, adapting itself to the changes of technology. That's why I would like to start considering that I really appreciate the painting over there. You know, this is a drawing of, well, it belongs from a drawing of Leonardo. Leonardo made it in 1490, and it's the Vitruvian Man, very famous drawing. And this is a Vitruvian woman as to prove and to show the continuity of these branches. The goal of this small course will be to show you tips and tricks of this philosophy. So I would like to introduce you Dr. Pesic, who will start showing you the anterior compartment, the bladder pillars, the anterior parametrium, and all the tips and tricks related to this kind of surgery. After that, Dr. Putenbecker will show you the spaces of the pelvis, basically related to radical hysterectomy, so the lymph nodes and the pararectal and paravesical spaces. And I will stop, I will conclude the dissection with the posterior compartment, presacral area, and the nerves. Before starting, I would like to spend a couple of seconds of silence in order to respect this woman, this specimen, who is right now for us in order to give us knowledge and in order to help us to pass from a surgical anatomy to an anatomical surgery. Thank you very much.